Hey guys, Dr. Dona, specialist plastic surgeon. Now, I recently posted 3 videos on breast lift surgery. They're extensive videos. It takes about 30 minutes in total, so I discuss every aspect regarding that. However, I got a lot of people contacting me and saying they wanted a summary. Give me a summary, that's too much to watch. Although I do encourage you to watch it. The links to those videos, if you're watching this on our YouTube channel, are down below. So, what is a summary regarding breast lift surgery? What do you need to know? Well, simple. Breast lift surgery means when the breast has either drooped over time, well, that's how you develop. And essentially it means lifting up the nipple and breast tissue to create a better breast shape. That's what a breast lift is. Now, from the scars involved, because different types of breast lifts mean different types of scars, you can have a breast lift with a scar just around the areola, another breast lift with a lollipop lift with a scar around the areola is straight down, and then there's the anchor breast lift where it's like a lollipop but an additional scar in your lower breast fold. And essentially, the greater the amount of lift required, the greater the scars. Now, I'm just giving very generalizations here to make this nice and brief. Now, doing a breast lift can be done on its own, but a lot of people also want extra volume. So they want a lift and they also want extra volume. In other words, implants. Now, whilst fat transfers can be involved, that's another topic. If you want genuine, real volume, then we're really talking about implants. So when someone needs a lift and wants volume, what are the options available to that person? Well, the first option is to simply just do a well-planned and performed breast augmentation. A lot of people have a degree of droop, but with a well-performed augmentation, you can actually create quite a nice breast lift. In other words, the only scars in the lower breast fold, as you would do for routine breast augmentation, and that's all you do. Beautiful. The second group of patients are those who are sort of borderline, maybe they need a lift, maybe not. So for those group of patients, what I would generally do is I simply perform a well-performed or do a well-performed and planned breast augmentation, knowing that most of the times in that group of patient, we're probably going to get away with it. In other words, they have one scar in the lower breast fold and that's all we do. Now, keeping in mind, breast lift or not, a well-done breast augmentation is going to give great upper pole fullness, cleavage and side boob. It's only the nipple positioning and the underboob that becomes an issue if a person needs a breast lift. So for that group of patients, you do a well-planned augmentation, let it settle, and by 6 months, you'd know if you get away with it. In other words, you critically assess the results in 6 months, and it's either going to look beautiful, or they'll say, you know what, nipple's a bit low, a little bit of underboob excess, it bothers them, so in which case you then do a breast lift. And there's nothing wrong with doing that. And they potentially avoided the additional scars and costs and potential problems associated with having a lift at the same time as an implant. The other group of patients are those who need a lift and also are going to get implants at the same time. So it's combined lift implants. Now, I'll say it right now, it's a very complex procedure. I only offer that to a certain group of patients, and I won't get into details relating to that. You can watch the other videos about that. But for that group of patients, so we do a lift, whatever lift type patterns required, and the implants, and beautiful. So, but having said that, I always stress this key point. By 6 months, once we're critically reviewing the final results, about 20% of those patients will require further surgery to further improve the results for a variety of reasons. It's usually relatively minor surgery, but it's still surgery with all the inherent downtime, potential cost, etc. So every one of my patients need to be aware of that before we proceed with that option. The other group of patients who need a lift and want implants, but they're not suitable to have it done in one operation. So for those group of patients, what happens is they get 2 planned operations. The first one is to do a breast lift. So sculpting, lifting what they have already to create a good breast shape. And then once that's settled down, reassess it. And then at 6 months, or no sooner than 6 months, if they still want to be bigger, because often they don't, then we can do a breast augmentation. Because once you've got a good breast shape, it's easier to do a good breast or breast augmentation then. So that's a 2 planned operative approach. And another option taken by many surgeons is to do a 2 operative approach, but do it in reverse. They do a breast augmentation first, and then at a later date, they'll come back and do a breast lift. Nothing wrong with that. I don't like doing that because, like I said, a lot of patients, once you've done the breast lift, they're happy with just that. And then you also have another group of patients who need a lift, want to be bigger, but they don't want to lift. They don't want the scars. They don't want to pay the additional cost. They don't want the potential complications associated with having a breast lift. All they want is the fullness that an implant's going to give them. And in clothing, they're going to look great. Naked, they're not going to look great. They're going to have implants sitting high and the breast tissue hanging from the implant. But they're aware of that and they say, okay, cool. Very few people see me naked, so I just want to look good in clothing, lingerie, and that's all I want. And there's nothing wrong with doing that as long as the patient's aware of that, you discussed it beforehand. And if at a later date you say, you know what, I like this, but yeah, I'm finally prepared to accept a breast lift, then you can have a lift at a later date, no big deal. Anyway, that's my summary on breast lifts with or without implants. I hope you enjoyed that. I still encourage you to watch the actual complete lengthier videos where I discuss all those aspects in a lot more detail. Chat later.